Hello and welcome to the Pause It podcast. I'm Dr. Sam, and with me, as always, is the awesome Dr. Robert.
Hey Sam, how you doing?
I'm really good. How was your day?
It wasn't bad actually. I went snowboarding the last 2 days, and my mom will find out about this later, but I didn't tell him yet. But I learned I'm old and fell down, and I don't know if you guys see it, but I got bruising all along my hand here.
Oh no.
I'm hoping it's not fractured.
I was
I
gonna
go
say,
to the
did you go
clinic.
to the doctor or no?
No, because that's not what I do. So I've been
Yeah.
icing it a lot, and if I happen to fall on the X-ray table at my clinic on Friday, it's
We don't
fine.
do that. That's
No,
frowned upon.
no,
We
no,
never do that. We're never the doctors that treat ourselves, ever.
never.
Never.
So, but no, I think it's just fine, which is good. It just looks a lot worse than it was, and my colleagues like to make fun of me for it. So
Yeah,
it was a fun weekend. Otherwise,
that's
very
good.
humbling.
I haven't
So,
been snowboarding in forever. Snowboarding's the best.
oh, it's so much fun. It's a very exhilarating. I'll say that. So it's nice to go
Yeah.
fast,
I mean, I
but my
literally
hips are a
haven't
little
gone
sore.
in quite a long time.
Quite a long time. Well,
Yeah.
if you ever want to go sometime, grab
Yeah.
Paul and the kids. Let's do this.
I grew up skiing, so like I think
Yeah.
that would be like riding a bike for me, even though I loved snowboarding, but I don't think I ever got good enough that like that would be the thing I'd go back to. I'd probably have to go back to skiing. I don't know. I don't know though. I
Skiing's
don't know
still
if I'd be
fun.
able to do it now. I don't know. I feel like
I pay to watch, so
I'm very graceful when I fall. I don't think you know
I
how
mean, I'm much
graceful I
better,
can be.
obviously.
Yeah.
So next time.
Yeah. Yeah. Well, that's
Oh,
good. I hope that you feel better, and I hope you did not break
thanks.
it, because that
Nope.
if we all see him next week with a
The
cast,
cast.
then we all know
Yeah, one of those
exactly how he
fractured.
did
So,
it. Can't tell some
exactly.
amazing story then, because we'll all know exactly how you did
Exactly. That's
it.
no lies then.
Right, exactly. Exactly.
Oh man, my mom's gonna love this
Uh,
podcast later.
well, it's very exciting. Uh-oh, Robert froze for a minute, but I know he'll be back. Up, you're back. Um,
We're back.
so this month is Dental Health Awareness Month. Did you know that?
I didn't actually, and it's probably because I don't do a lot of dental, so thank God.
Well, I do a lot of dentals.
Hmm.
So I'm really excited to talk about pets' mouths, because I think I tell people every single day that their pet needs to have their teeth cleaned and that their teeth are not healthy or they're starting to get some periodontal disease. And so I think it's a really important topic that I think we need to talk about, especially because it's February.
And I'm gonna learn a lot from you this podcast because I see the later stages where they have no teeth. I'm talking to all the Yorkies out there.
Mm-hmm. Yeah.
So I'm gonna see all that side of things pretty much. So I'm very excited to learn about all the things preventative dental because I don't have
Preventative
that
dental health.
conversation
Yeah.
ever.
Well, I guess the couple of things that we'll say first off is we also later this month have a really cool product that we'll be kind of introducing to people. So we're really excited about that. So stay tuned. You have to listen. It's
Yes.
gonna be really exciting. And also just kind of look out on my Balto. We'll be kind of putting up some dental health stuff and really kind of focusing on some of the things for Dental Health Month. So take a look and check it out. It's gonna be very cool.
Yep. We're also gonna have our new app and new website design too. So feel free to bounce around on that and check it out. To be much more user friendly and much more informative than it was previously. So it's gonna be a great month. February's gonna be a lot of fun. It's got some
Yeah.
teeth stuff, got some
Yeah.
My Balto stuff. It's all gonna be great.
I know. I'm actually really excited. I think there's a lot of really cool stuff coming this month. So I'm like, I'm ready. I think people are going to like it. I think people are going to be really excited. And I
Mm-hmm.
hope that everybody's excited about it as we are. I think we're always kind of growing and trying to make sure that we're doing what the thing that we set out to do, which is
Yep.
just like really try to make veterinary medicine something that's like very accessible to people, and like people can understand it a lot easier. And like I said, if we're ever saying things that you're like, what are they talking about? And you have questions, you can always email us at podcast@mybalto, because we really love to answer questions. So we're happy to do that. But getting into dental stuff specifically,
Yep.
um, I think one of the biggest things that people get surprised about is A, how common dental disease is,
Oh yeah.
B, that they should be cleaning their dog's teeth. Like we should be paying attention to prevention from the time that they're puppies, getting them used to things that we can do to help keep their mouths healthy. Because I think that people don't realize that. I mean, I know growing up, we had dogs, and like we we never brushed their teeth. That was not even
No.
a thought, right?
I
So
still don't
sometimes
brush my own dog's teeth, and I'm a terrible vet for that. So, yeah, but I should. I got him as a rescue at 1 year old, though. Like, he's a husky. He's not going to listen to me at this point. So,
well,
but
but there's things you can do, right? So like there's all different ways to help your dog's mouth. And I'll be honest with you, I was actually like in preparation for this podcast going back through and looking at some of the things that just reviewing some of the stuff that I know to be true, just making sure that I was giving accurate information. And so I came upon a really good lecture. I'm a nerd through and through, so I was totally excited to be like rereading this lecture and be really excited about it. But actually it was one of like a really well-known veterinary dentist, and he admitted that he's not the best about brushing his own dog's teeth. So
see,
it's not like all is lost if you absolutely cannot brush your dog's teeth. There are things you can do. Now, obviously the gold standard, and any veterinarian will tell you, brush your dog's teeth.
mhm.
There's specific toothpaste for cats and for dogs. So yes, this includes cats too. And I think people think that's absolutely nuts, but you can brush a cat's teeth. Absolutely. And,
Mhm.
trying to get them used to it. Obviously the younger, the better, get them used to
Yes.
having them handle their mouths. And it's not like, if you have toddlers, which I know you don't have toddlers, but I have 3 kids. And so brushing their teeth is like, I mean, you got to set a 2-minute timer and it's a whole thing. And then you're sitting there making sure they not just holding it in their mouth. Like you actually
Yep.
have to, it's not that involved with dogs. It's really a much quicker process. And I'll probably maybe even actually I can just explain it here, but it's pretty easy. You just focus on the outside of the teeth. You never have to get the tops or the insides. They get a lot of benefit from chewing, but you do really need to focus, especially like the chewing they only really chew with their like cheek teeth, right? So
Yeah.
they don't really chew with their front teeth and with their
Incisors
canine.
and
Yeah,
canines, all that fun
exactly.
stuff.
So really what you need to do is either get, those little finger brushes.
Oh, is that what they use?
They have, well, you can, that's one thing you can use. So like finger
Okay.
brushes, that they have for like toddlers, they have them for dogs, and any place you can buy the toothpaste. You can get those little finger brushes or just like a soft bristle toothbrush and just focus on the gum line on the outside of the teeth, get it on there, just kind of disrupt the, tartar, and then, or not tartar, I guess. I can explain the difference between tartar, by the way, in a minute, but just kind of disrupt the plaque that's forming on the teeth, and then you're done. It's like a 30-second thing. It really doesn't take that long. I don't know why it does seem like it's a really Herculean effort though to do it. So a lot of people don't do it.
I think as my hesitation as a owner, say veterinarian aside, is like depends on the dog, right? Like I see animals that try and bite me coming to the clinic. So I guess I imagine that a pet owner, like some dogs aren't going to tolerate that. Some owners can't even get their dog to take pills like that. Those are heroic efforts as it is. So to ask them to brush their dog's teeth
Every day.
is a big, exactly, every day is a big ask.
Mm-hmm.
So yeah, I guess I don't blame some owners for not doing it as frequently, but I think if they start younger, I think it's just as important. Like that's probably the big thing I missed out on. I did not do it early on.
Yeah. And so I actually with this dentist, so I mean, I guess I'm trying to think about the best way to kind of like explain the whole thing. I think the most important thing to understand is how fast plaque actually is on your teeth.
Accumulates.
Oh yeah,
Yeah.
yeah. It's very, very quick. Like even after a dental cleaning, within 12 hours, they're already getting plaque on their teeth.
Really?
Yes, including you
Yikes.
and me, everybody. Like that's just what it is. And then plaque becomes tartar and calculus. Like basically tartar is what plaque becomes, and then the calculus hardens. And then there you go.
Hmm.
That's what you're seeing. And
Oh, I didn't know that.
so yeah. And so there's bacteria, and it's all just sitting there causing inflammation, and that's periodontal disease. So that's what happens in your mouth.
Yep. Oh, so like say that there's one option is to brush your dog's teeth. What if you can't brush your dog's teeth? What are options that you talk to owners about?
Yeah. So there's a few different options, and there's kind of, so obviously brushing the teeth is gold standard every day. I have heard one veterinary dentist say if you can do it at least 3 to 4 times a week, you actually will make a difference. If you do it once a month or just when they get groomed, which is the one thing that I hear all the time. Although they do that when they groom him. I'm like, once every six
Do
weeks.
they?
Yeah, they might, but it's
They
also
might.
once every 6 weeks. If we're not addressing it in any other way, then we're not addressing it. You know what I mean?
Mhm.
And so, one really helpful tool that people can use to find like good products for whether or not something's actually going to make a difference, because the whole point of it is to try to disrupt that plaque, you know, and the
Build
tartar
up.
from forming, right?
Yeah.
So there is actually like the veterinary version of what the American Dental Association is, like ADA, you know how things are. So we have VOHC, Veterinary Oral Health Council. And
Oh yeah.
so what that is comprised of, I think, is like 5 veterinary dentists, like board certified dentists. And yes, there are board certified dentists that are veterinarians that
And we'll talk about at some point
do.
when you should go to them at the end of this podcast.
Yeah, exactly. And then I think there's like one other like main person, but anyway, they evaluate dental products, and if they can prove, and so there's like a certain matrix that they have to reach in order to get that seal, and it's like an acceptance seal basically.
Mhm.
They have to, the product that has that seal or whatever has to reduce plaque by at least 20% in 2 separate studies.
Oh, really? Okay.
Yeah, so it is actually based in something. Now there are some that go up to like 70% of plaque. You know what I mean? But
Yeah.
it has to be at least 20% in order to get that acceptance on it. So obviously everything that has a VOHC seal isn't created equal necessarily, but they are all useful products. So I would say that when you're like going on Amazon, because if you just look through Amazon, I mean, there's just tons and tons, and you could scroll forever and find
Oh
all
yeah.
sorts of different products, or you go to the pet store or whatever. One way to at least kind of decipher whether or not something's remotely useful, that's a really good start. So it's VOHC is what it is. That's a really good start.
Oh, nice.
And actually there are toothpastes that have that. I'm pretty sure, yeah, that have that
That
on
seal.
there. Yeah. And then so one of the other things that like as I was going through, so there's like, I think it's like 15 different products for cats and like 43 different products for dogs. I mean, like, so there's a lot to choose from of
Mm.
things that are going to help your dog's teeth. And there's basically like 2 categories, right? So there's going to be like mechanical. So like brushing the teeth is mechanical.
Mhm.
The other thing that's mechanical, I would guess that you would consider, are the wipes. So there
Okay.
are actually like pretty decent wipes that can go in. And I think those are easier to use than having to set up a toothpaste, set up a toothbrush, and, you know, get in there.
Oh yeah.
To just be able to take a wipe and use that is pretty good. And this one veterinary dentist whose lecture I was reading was also saying, so what he does is he uses the wipes. We can probably link at some point to which ones he said, because I just
Yeah.
off the
Yeah.
top of my head don't remember what they were. But I was actually going to look into them for Gus because I'm not the best at brushing his teeth.
And the truth comes out.
I know. I
I'm
do
getting all
it.
the sass over here.
I know. Do as I say, not as I do. But anyway,
Okay.
and then he gives a chew. So
Okay.
basically he's addressing the front teeth that don't get the benefit of the chewing
Mhm.
with the wipe, and then he's giving them, and then he had like 2 different chews that he uses.
Oh, nice.
So that's kind of one approach. There are foods that can actually help with dental disease, like prescription diets. And there's specifically what it does is it kind of works to like scrape the tartar when they
Mhm.
chew. Again, the only teeth that are going to get any benefit of that are your chewing teeth. So
Yeah.
you're not really doing anything to address those front teeth. Um, and then there are additives to water and stuff like that. There's variability between which ones are really helpful and which ones aren't. And I think we'll be talking eventually. And actually, we have an entire podcast that's going to be devoted to a newer way of doing that, which I think is very exciting and really promising and very cool.
Yeah.
And so it's something, stay tuned, that you'll get to hear from just a really smart scientist about how that works. I thought
Yeah.
that
Excellent
was,
speaker too. Honestly, really
yeah,
enjoyed our conversation with her.
yeah, she's great. So I thought that was, so stay tuned for that, because I think I learned a bunch from her too, which I thought
Oh,
was
so did I.
awesome.
That was cool.
um and so there are, but then there was like additives to the water that are meant to more disinfect. I don't
Sure.
think those work as well, truthfully, in my opinion, because what I find with things like chlorhexidine, which is like something that we use a lot of times in um like on
Wounds
skin and
and
stuff like that and wounds,
yeah.
it's contact time that really does its job. So I guess I'm not entirely understanding how that would work exactly in the mouth, because I just don't think it hangs out long enough.
Sure. No, I
But
get that.
yeah. But some of those are listed, and then so I guess that would be more of a chemical way of dealing with it versus a mechanical way. And so those are kind of the two bigger ways to look at it.
Oh, nice.
And those are things that so some are more passive than others, right? I mean, like obviously feeding a food. So like Hill's Science Diet, they make the TD food. It's like T/D. And that is a definitely, and they have their like big chunks of food, and that's the teeth kind of sink into them.
Yeah. I'll say generally kibble in general is gonna be better for their teeth than wet food, because they just have some, like I said, mechanical abrasion, at least while they're chewing. So like that goes for cats and dogs. Like kibble in general will be better for their teeth, but we'll talk about later, I guess, how cats actually benefit from wet food because of its higher water intake, which cats don't always usually drink a lot of water. But yeah, just in general, kibble is better for their teeth.
Well, and I think the difference between cats and dogs too is if you watch a cat eating dry food, they don't really chew it. They just kind of prehend, and they're carnivores. So they have, if you look at even just the way that their teeth are formed, they're all sharp. They're not they're not really sitting there.
Yes, they are
chewing, you know. You know what I mean? Like we have teeth that are meant to grind our food and chew, and they have an occlusal surface. Cats, I mean, they do, but like they're all sharper. They're meant for, they just
grabbing and pulling.
Grab and pulling and swallowing. Like they don't really do a lot of chewing. Which is why actually a lot of cats that when they lose their teeth, they still eat dry food because they don't really chew it. So they're not really missing very much, truthfully. But they also don't get that much benefit. And there used to be the kind of like the thought process that having a cat on dry food would help their teeth. It really doesn't.
Yeah, that's why the wet food's
wet
good
food
for their health.
But then in dogs, I think the problem is there are some additives to canned food that can kind of stick to the teeth. And I think anytime you're starting to get food and stuff up into these periodontal pockets, once they start to form, so once the gum starts to separate from the tooth, you're going to get what's called a periodontal pocket. And once there's food up there, that's where you start to have those dogs that are like, why does their breath smell like that? You know, oh my gosh. You know what I mean? Because they're already starting to have evidence of dental disease at that point. And I tend to be a little more aggressive as far as like when to start doing their first dental cleanings, because I'm not one that wants the teeth to be falling out of their head by the time I'm doing their first dental cleaning. Because if we can try to keep their teeth in there, if I can try to keep it healthy, then that's great. Plus, I mean, I think it's important to know what a dental is, because I can't tell you how many times I've had people come in and say, oh, hey, yeah, can you do that today? Like while we're in an exam. And I'm like, oh, no, I have to anesthetize your dog. Your dog will be under anesthesia.
A lot of people don't know, actually, or realize, or they try and see if you can do it without. And like, it's not actually recommended even by the AVMA. They recommend not doing dentals under like normal being alert. Like you have to anesthetize them because they, one, don't understand what we're doing. Two, they'll try and bite us during that process. No one wants you cleaning their teeth and understanding why that's going on. So anesthesia is necessary, unfortunately.
Yeah. I think the other reason why they make a really big push for anesthesia in pets is not because we want to just anesthetize pets, but because 50% of what happens in the mouth happens under the gum line. You can only assess that with radiographs. I cannot take a radiograph of your dog if they're going to bite my radiograph plate. It just can't do it. So there's no way that I'm going to be able to position them, get a radiograph done. So that's an x-ray. If you think about even just when people go to the dentist, when we're taking x-rays all the time because so much disease is happening where we can't see it. The other thing is, once they start to get those periodontal pockets, there's no way I'm effectively cleaning one without getting subgingival. There's no way I'm doing that with your dog awake. I mean, yes, occasionally, I suppose there are those dogs that will let people hand scale their dogs at home when they're relaxed.
That's few and far between, though.
It is very rare. I have a few dental hygienists that are like, oh, I hand scaled his teeth. I'm like, great. You know, but the problem is every little abrasion you're making, if you're not polishing it after, more stuff is just going to stick to it too. So, I mean, there's reasons too, also not to just be like clipping off, like, you know what I mean? I'm just going to knock off a little bit of tartar here and there, because then you're just leaving an irregular surface. And the other thing too is then if there's pain, if there's actual like root exposure, which feels to a dog just the way it feels to us. So you have an exposed root and it's that's painful.
There's so
So if
much
you're doing that
discomfort.
with them awake, I mean, there's no way you're placing a dental block with them awake.
No, no,
No,
not a chance in hell.
no.
So
So when we do, we call them complete oral health assessments and treatments. COHAT is what we call them. We used to just call them dental prophylaxis, but then we got real fancy and started calling them COHATs. So
and
that's what we call them
stuff you learn
now.
every day. I was like, what is
Yeah,
coac? Because
you're like,
I don't do dental in ER, and as a word of advice, don't come see your emergency veterinarian for a dental, or if a tooth falls out. There's not much we can do besides give you some pain medications in most cases,
yep.
Which is fine. That's a good reason to come in. But outside, the dog's fine, then or cat. But cat don't really lose their teeth suddenly, not as often. Have you
Well,
seen
they
that a lot?
they do, but like the cats are very good at masking things. But
Yeah,
like
that's
every
true.
once in a while, like I had a cat the other day whose tooth was literally just barely hanging there, so he couldn't close
Hmm.
his mouth because the tooth would
Oh,
keep
okay.
moving every time. But he had horrific dental disease, and so we had to go in and
Okay.
do full mouth X-rays, full cleaning, and then checking all the teeth for periodontal pockets and further disease. And we ended up pulling quite a bit of teeth actually.
And
But
that's
we
part of the cohat
placed
too.
exactly. So that's what that means, a complete oral health assessment and treatment. And the whole point is that you are completely assessing it. So that means doing what you need to do as far as radiographs go. And we don't like where I work, and actually I'd say the last two, so where I worked before I became a veterinarian as a technician, and then the first place I worked as a veterinarian, and then the place I work currently, we do full mouth x-rays on every single dental that comes in. It's not even like,
Hmm.
it's part of it. It's like a package. You come in, and then that includes anesthesia. We do full blood work, make sure most of the pets that are getting dentals on a regular basis are generally older.
Okay. Yeah, that's
Occasionally we'll
true.
get like middle-aged to older, but either way, and they're usually a bit longer, because we're getting a full mouth x-rays, and then we're cleaning the teeth, and then we're, pulling any teeth that need to be pulled. Um,
Yeah.
and so they do
How
kind of
often would
tend
you
to take a bit
say?
longer.
How often do you recommend? So about once a year for most dogs to get dentals, or do you wait even longer?
So it really depends on the dog. I mean, I
Hmm.
think that, so like I have a lab and he's got pretty nice teeth and he's young. So
Hmm.
he's never had a dental. So he's 2.5. He doesn't really need a dental yet. I might do one like towards like as he turns 3, just to
Okay.
kind of be a bit proactive where he has just like a little bit of, you know what I mean? Just make sure that his roots all look healthy and make sure that I'm getting to his teeth before they become a problem because I want him to keep his teeth his whole life. I
Yeah.
think you're going to find like a lot of bigger dogs, they just don't tend to have as much dental disease, be it genetic or, um, they chew more. I don't, you know what I mean? Like there's a lot of different reasons why they will, have better teeth, but you'll notice that they don't really need it until they're a little older.
Yeah.
Um, you'll start to see evidence of dental disease, and that's when I'll say, hey, I think they're okay. And then you're always having to weigh anesthetic risk with the benefit. um but I think that getting to them when they're young and have less of an anesthetic risk, and the procedure itself is going to be shorter. If I'm not having to stay there and pull a whole bunch of teeth, we are talking about going in, doing the x-rays, cleaning the teeth, and hopefully then we're done. That's my goal.
I think it's the biggest thing, like letting them know that like it's a much shorter procedure is doing the cleaning and not having to pull the teeth out because I mean I don't even know I've only pulled teeth out that are literally falling out of my patient's face, like essentially. How long does it take, in general for you to take each tooth out?
It depends on the tooth.
That's a good part of it. So like the ones that
There's
are
a
like single
reason.
roots,
So certain teeth have certain, like most places, I will say it's not every place is the same, but generally like a one rooted tooth, so an incisor is not going to cost the same as a 3 rooted upper forced premolar, where that's their big chewing tooth in the back.
mm-hmm.
Um, unless those teeth are so diseased that they're hanging out of their mouth and wobbly, you're going to have to do oral surgery. I mean, it's a whole process to be
Yeah,
able to properly take them out without breaking them
yeah,
either. You know what I mean? And you can't leave roots behind. So you really want to also make sure that you've also extracted that entire tooth when you're done with it. So that's another reason why dental radiography is so important as well.
yeah.
Um, and so, I mean, it is a process. It's oral surgery. It's not just like, oh, let me just pull this tooth. I mean, their roots of their teeth, where you see the crown, is just the tip of the iceberg. There is a very big root in there. In fact, I kind of think I almost wish I should just have a bunch for people to be like, this is what a canine looks like, so that they understand.
Good call,
People
though.
are like, oh, don't take their teeth. And I'm like, oh, I will not take a tooth that doesn't need to be taken. I promise you.
Yeah.
I take no joy in pulling a tooth that doesn't want to leave a mouth. If I can save it, I will save it every day.
Yeah, because they're so
But
hard to pull out in the first. If they're healthy teeth, they're
oh
really
my
hard to pull
gosh,
out. Like they
very
don't.
hard to pull out.
But if
Healthy
they're
teeth do
unhealthy,
not
it's
want to leave the
easier.
mouth.
Yeah.
There are certain types of things that happen in the mouth, like sometimes the roots will almost, it's called ankylosing, like it almost becomes one with the bone there.
Oh
When
yeah,
that happens, that is very, very, even though they're diseased teeth,
that's a good point.
not every ankylosed tooth is diseased, right? Like not everyone has to come out of the mouth, but like when they have to come out, they aren't easy to take out. I don't think. I mean, and I'm
You know better than I do. Like I said,
constantly,
I don't take
well,
them
the
out
thing
very
is,
often.
I'm always trying to improve. You know what I'm saying? I'm always trying to make
Oh
sure
yeah,
that I'm studying and making sure that I am doing like the best version of what I'm doing, you know? But I feel like we always have a place to grow, you know, and I feel like I'm
oh yeah,
always learning every time I do a dental how I could be more efficient or how I could, do a better job with the extraction or whatever. But yeah, I mean, it's, you just do your best. And I mean, I've done many, many times,
and you're doing something a week. I think like every time I talk to you, you've done at least 2 a week minimum,
at
if
least
not
2 a
more.
week. Yeah. I mean, there's some
So
weeks where it's 4 a week, which is
yeah,
like,
that's
that's a lot. It's a lot of dentals. But I mean, there are some people who do 4 in a day. Different practices we only do 1 a day because we really try to make sure that like we're doing full mouth x-rays and all that kind of stuff. And just the
yeah.
way that our surgery schedule is set up, because we always have a dedicated technician that's there the whole time helping, monitoring, making sure like we're
Hmm.
really, really careful about making sure that the anesthesia is as safe as possible. And so, we don't ever, there's never a time where the patient's not being monitored really closely. You know what
Yeah.
I mean? So there's just only so many of those you can do in a day, I think.
Oh, I would agree. Yeah,
Yeah.
they're very time consuming.
Oh yeah, absolutely. But they are so helpful when dogs have really, really diseased mouths. I think that sometimes people get really, really afraid of the anesthesia. And I do understand anesthesia. There's no such thing as anesthesia without risk.
Yeah.
But the amount of disease, I mean, I know, I'm sure like systemically.
Yeah, like they've shown a lot of studies even in the last 20 years. They've talked about like how dental health, we've already seen it in human medicine, first off. Like they've shown studies already showing like atherosclerosis of your vessels and how it can cause like endocarditis, which is infection of like your valves in your heart. So that's just in human medicine alone. And now they're starting to show that in the last 20 years in veterinary medicine as well, where it's affecting your kidneys health, where you can get higher percentages of infections in your kidneys. It can affect infections in your liver and also affect your heart. So like, and they're even suggesting that it's actually leading to clot formation in dogs and
I had
cats as
heard
well.
that.
Yeah. So like all this preventive care, it really is a systemic approach. Like
Oh
it's
yeah.
so important to do preventive because like I said, shorter anesthesia times when you're like you were just talking about healthier long living and even some of the information you guys get next week with or 2 weeks with our guest talking about teeth. She knows so much and some of the information she was sharing was like shocking to me. So
Yeah. Oh, me
it's
too. And I'm like,
yeah,
I thought like, you know what I mean? I feel like there's never an end to what you can learn. I
agreed.
think that with biology, if you think you know it all,
You're
you're
wrong.
wrong.
You
You're
were
very
clearly
wrong.
wrong. You're just
That's,
wrong and
yeah, that's when
and
you
just
should
that
maybe think about not being a veterinarian anymore, like, because you think you know everything.
if you think you
No.
know everything, you're not a good veterinarian because you just don't. There's so many things to
Yeah,
learn, and we can always improve. And I think it's
always.
realizing that it's like just like anything else, whether it's systemic biology where you're looking at environments and how one animal is a predator. If you get too many predators, the prey drop off. It's all interconnected, just like your body. If
Yeah.
one system is off, it will affect the rest of your body. So that's
Hmm.
why it's important to have that systemic health with starting with your mouth. It's what you eat. It's how you keep things clean. Got to
Oh
start
yeah.
there and keep it, make sure it's healthy.
Yeah. And so, I mean, I think for those people who are getting a dog from puppy, that's one of the things I tell them. I'm like, yeah, get them used to cleaning their ears, get them used to brushing their teeth, clipping their
Mm-hmm.
nails, all those things, picking up their lips, all that handling is really so important, because there's no reason that you should be afraid to open your dog's mouth and do those types of things.
Yeah, especially if they trust you early on. Like that's the
Yeah,
time to do it.
exactly. And make it positive. I mean, it should not be a negative thing. They shouldn't be feeling like they get punished. The toothpaste that they sell is like chicken flavored. I mean,
Yeah,
that's
sounds
disgusting to me,
delicious.
but oh yeah, I know.
I like chicken. I'm go for it.
I mean, I like chicken, but I don't want to brush my teeth with it.
I had to try it out first, and maybe one of these days I'll come back on the podcast.
Great.
Like,
You'll
well,
give us, you're like, try that.
tried it.
Well, there, I will say there is one that's vanilla mint. So if
Really?
you're really going to try an enzymatic pet toothpaste, I would go vanilla mint.
Oh God,
But
think
but I
busy for this
think
podcast.
Robert's like, oh, vanilla mint's pretty good.
Oh God.
But yeah, I think as with anything else, if you can keep your pet healthy ahead of time, you will save money in the long run. You will
Yes,
save your
most
pet
certainly.
having to go under anesthesia. I mean, it's my favorite thing when I pick up a mouth and I'm like, oh, did you brush your dog's teeth? This looks great. It's the best. And if you have a
Oh,
little dog, it's an uphill battle.
yes, you were going to struggle from the beginning, not because it's your fault. You
No,
just
I mean a Yorkie. I have done extractions on a 1 year
ugh,
old Yorkie.
really that young.
That young,
That's horrible.
1 year old extractions.
It's,
Horrible.
I mean, you're just cramming the same amount of teeth in a smaller mouth, and it's just
Yeah, but I think also too, and not to like get too into what we were learning too the other day. I mean, like they really, I think it makes sense. They make less saliva. I think that I'm onto that. I believe that because
no. I would agree.
it's,
I would.
I mean, it kind of makes sense that,
Mhm.
or, I don't know, but either way, genetics plays a huge role. Think about even with people, some people have soft enamel, they're prone to gum disease. It's the same thing with dogs. And we're not breeding them for dental health.
No, God, no, because
That's definitely not even something
God,
that they're
no.
thinking about. They're doing, oh, this is a really cute puppy. It's a really sweet puppy. They don't care if their teeth are going to fall out of their head. I
Mhm.
don't think it like even, do you know what I mean? Like that sounds callous. I don't mean to say that like they don't care, but I mean like that's not what
It,
they're breeding for. It's not
well,
selecting
it's
for
also
that.
something you probably don't notice when they're young either. Like when they're
No.
young, they have nice teeth. You'd not be able to predict it 12 years later when they have like their teeth are falling out. You're like, well, I wish I'd looked into this when they were 12 years ago. Like
Right. Yeah.
you're not
Well,
gonna
and I
remember that
think
kind of stuff.
it's probably important to know if you have a breed that is particularly prone to dental disease, because it's not only the little guys. Greyhounds
Yep, that's the one. I love those dogs
brush
so
their
much,
teeth.
but God, they have the worst mouths.
I love them, but yes, you got to brush your teeth. Poodles, all poodles, which is why the more we doodle things, now everything is a dental disease.
The more we doodle things,
The more we doodle things, there
I'm
you
starting using
go.
that as a verb from now on.
I know. Well, I mean, and I love a doodle. I am not
Oh
dissing the
God.
doodles, but you gotta brush the doodle's teeth. You gotta just expect it. They're gonna have a problem, so brush their teeth and clean their ears and pluck them, I think. But anyway, the doodles.
Welcome to my TED
Uh,
Talk.
who else is big that needs? Oh, and then anything smushy, like we talked about with the Frenchies.
Yeah,
Although that'll be. Oh no, that's
yeah.
next week. Oh shoot,
Next
that'll
week,
be
yeah.
last week. We're
You hear about it
confusing
eventually.
everybody. You'll hear about it next week. No, you just heard about it last week.
Oh man.
Yeah,
Yeah.
we're good. We're really good.
Yeah, we're doing
But
great.
anyway, um, yeah, anything with a smushy face, they all have, because that really is cramming all the same teeth into a tiny
Yeah.
little place.
Yeah,
And
it's
then everything's crooked and moved around. And so that's like all the little things like
and our lower
pugs,
jaws farther
Frenchies.
out and just
Yeah, and they're so cute, but then they have
that's a really good impression
no
of it, by the way. Like
thanks.
y'all need to watch this podcast if you're
No,
gonna watch
please
one of
don't.
them.
I know. Between the toothbrushing and the like, oh look, I've got a bigger tooth. Yeah. Oh no.
Oh man.
There's gonna be some embarrassing clips on
Oh, I can't wait to
social
post them.
media. I'll be
I'll make
like,
sure I find this one later
ooh,
on.
go right through that.
Oh
um,
man.
but I guess the takeaway, the really simple takeaway would be like if you really are just faced with a whole bunch of products and you're like, I don't even know. I mean, obviously ask your vet for
Mhm.
sure. That's always going to be a disclaimer. And we say that not because it's just like, oh, ask your vet, but they really do know your pet the best. And so sometimes there's special circumstances where they might say, oh, your pet really needs X, Y, or Z thing. So they're definitely the first person to ask. But VOHC, take a look, make sure that you're kind of specifically looking at those products, just as a guideline. That doesn't mean that any other product isn't good. It just means that they haven't sought out that specific
approval yet.
Yeah, exactly.
Yeah.
So I don't want to say that they you know, they can only have that, but it's just a good starting spot. Sometimes it's nice to just be able to narrow things down a little bit and be like, okay.
There's, like you said, there's so many products out there. I think you hit it right out there, just be able to narrow it down and start somewhere. It's a really great idea. So VOHC.
VOHC. Yeah.
Visit that site later tonight.
Yeah. Oh, I don't even know if they have a website. It's just like a seal on, you know what I mean? Like, okay. It's on. I guess I didn't even look into that. I never thought of that. Well, now I'm gonna go look. We'll all gonna go look. We'll all learn something today, or not. I don't know.
But on the other side of that coin is if you do wait too long to treat your pet's dental disease, some things will happen as they get older, and some things you can't control. Like we said, talked about genetics. One of the few things you might see ER for is dental abscesses or tooth root abscesses. Particularly if you notice your dog like having swelling towards like right underneath its eye on either side, usually it's probably a dental or tooth root abscess. So something to, one more reason to do preventative care, because you have to do extractions. Like that's the only way to fix them. You can try antibiotics for a short time, but it's more of a keep them static for a bit. But most of the time they need dental work at some point to get those extracted out.
There's even times where antibiotics, like they'll work a little bit, but then they won't. I mean, I had one like recently that we did, the anti-inflammatory helped more than the antibiotic. I know that seems like, but they're finding more and more that, you know, because the problem is, and I think people ask this all the time, and this is just with dental disease in general, is like, at least with an abscess, there's blood flow to an abscess. So if there's blood flow and you can get the right blood level, an oral antibiotic will help, right?
Yeah.
That's the whole point. So that's the problem is like with generalized gum disease, you cannot get a high enough level of antibiotic to get there locally with an oral antibiotic. So it doesn't work. To pulse antibiotics for dental disease is absolutely not a useful thing to do.
No, it's great advice. Like it's a whole mouth issue. So like, yeah, you might have that one tooth that's infected, but there's other teeth that are going to be a problem. So most likely you have to see your primary care veterinarian to either one, get that one extracted, or just get a cleaning in general, because it means the rest of your teeth are not off to a good start.
The other thing too is you can get fractured teeth. I don't know how often you see those.
Fractured teeth. And do you just do extractions on those yourself? Because I know sometimes we'll refer those out to like the few times we do see like a dental surgeon is when they either have like a fractured jaw, if the veterinarian doesn't feel comfortable doing it themselves.
Yeah.
A lot of times the dental surgeon will do like a lot of the jaw surgeries for us. Cleft palates, that's a big thing they handle as well.
Yeah, we've got a great one here. He's awesome actually, and I did just have a cleft, a little kitty, the cleft.
Oh really?
Yeah, and so he had actually said, well, why don't you get the teeth as healthy as possible, and then I'll fix the cleft, because I didn't really feel super comfortable. I mean, it's so funny because my mom is a plastic surgeon, and she could have come here and we could have fixed that cleft together, but I don't know.
Family bonding at its finest.
I know, right? I was like, Mom, come fix it. No, I actually wish I knew how to, it's just not something I've ever learned to do. So I wouldn't want to not do it right. You know what I mean? Like, I think, you know, it was definitely one of those things that I was like, man, it would be a super interesting surgery to watch or be part of, but I didn't feel like that would be the right thing to do. So I did refer them to the veterinary dentist, and we do a lot of work with the police dogs that have to do bite work. So a lot of times they'll fracture a canine.
Okay.
They need that tooth. So we will send them for a root canal, and they'll get a titanium cap usually on those teeth.
Which is really intimidating too for a German Shepherd or Belgian Malinois. Like,
I know.
Crap.
And I have offered for people to, so like if you have, what we'll see sometimes are slab fractures, which a slab fracture is like if you have the whole tooth, it's just like the side of it. So sometimes they'll go where you can actually see the root. If you can see the root and you can probe the root, that means it's exposed. And so you would need to do a root canal before you try to fix that tooth.
Yeah.
At my practice, we have the ability to like fill a little bit of a fracture, like a little bit of a slab fracture, but you have to be really careful doing endodontics. If you don't know what you're doing and you fix a tooth that is not healthy, you shouldn't do it. You know what I'm saying? Like,
No, I agree.
you either have a
That's
choice to like go get a root canal, and then you can cap the tooth or fill it back in, or just extract it, because
yeah,
you know what I mean. And I would say I don't know of any general practice doctors that do root canals. I'm sure there are, and I'm sure there's people who have learned to do them. They're not,
sure.
I've watched them. I've done like on my dental rotation, like I've seen them. They're not, I think you need to know what you're doing. You really need to understand how to read radiographs, and it's a specialty thing.
Yep.
But I think it is something that if you had specialty training, you could learn to do, I would
No,
imagine.
for sure.
Um, but I think you're best in the hands with a dentist. That's what if I felt like my dog needed that, I would go to the dentist. I wouldn't.
That's usually when I recommend them too. Like if you need a root canal, or
Yeah.
I heard they're even doing braces for a few dogs these days. You seen that?
Oh, no.
Some
You're
dogs
in
that like some.
California though, so people do
Well, they're
things like
like they
that in
want their. I'm like,
California.
their dog doesn't care if their teeth are straight.
No.
So
I
yeah, I
mean,
think
unless it's for bite work, like, you know what I mean? Or,
yeah, I guess maybe bite work would make sense.
yeah. I mean, that makes
Um,
sense. I'm trying to think of, I mean, because I have seen some malocclusions which basically means like things weren't lined up properly, where
yeah.
like a canine was going up instead of sitting like that, it was going that way or
Mm-hmm.
something like that.
That'd be uncomfortable.
Well, and those are, I don't know, but there's things you can do. I mean, like you can shave them down. You can, you know what I mean? Like there's other
Mm-hmm.
ways to do it. It doesn't always mean you have to extract the tooth, but they
Yeah.
have way more things that they can do that they'll know what's safe to do, what's not safe to do. I mean, there's a certain level to which when it comes to anything, I'll say, you know what, that's probably more than I'm comfortable doing. But I will be the first to tell you, if I don't think I should be doing it, I won't do it.
Yeah. No, I agree.
I mean, I'm always
That's
honest.
find a veterinarian that admits that. That's probably the best veterinarian to go see. They admit that they don't know how to do something, like, hey, it's okay. Like,
Yeah. Yeah.
do things, do well, and then things you don't, you refer out.
Yeah. I mean, you can't, I think it's hard in general practice. I mean, you just can't be an expert at every single thing.
Yeah.
At some point there's got something's got to give. But I think slab fractures are really common, partly because I think people let their dogs chew on things that are too hard for their teeth.
Mm-hmm.
And I think that's one thing we didn't really touch on, which is like, well, what is okay for them to chew on? Because chewing does help with tartar. That's true. But I think the old adage or whatever that I've heard, which I think is funny, is don't ever let your dog chew something you don't want to be hitting the knee with.
Interesting. Yeah, I guess that works. That's
so things like
that's a long
femur
list,
bones, yeah. So things like femur bones and stuff like that have that marrow in it that they love, kills me. But they'll fracture. That's harder than their enamels. They'll just chew that right. Yeah. That'll come right off. And it happened to Phoebe, my old Frenchie. I mean, she had a slab fracture, that they actually did fix at school. They didn't extract her tooth.
Oh, nice.
Yeah.
I think like nylabones are usually not a bad call.
So nylabones come in like different consistencies. There are ones that are harder and ones that are softer. They can actually fracture a tooth on the harder ones.
Really?
Yeah.
Oh, the harder ones. Okay, I guess I've only seen the soft. Like I get low-key the softer ones, and those help a little bit.
But then you got to be careful if you have an exuberant chewer, because Gus chewed the end off of one, and I was like, do I make him vomit? I don't know. Sometimes veterinarians lose their minds when it's their own dogs.
Oh yeah. It's literally the worst. I've seen the best veterinarians completely forget how to practice as soon as it's their own pet. And it's just, and I don't blame them. I'll do the exact same thing. So there's no judgment here. It's just
no. It's like something happens to your child. You're just like, I forgot basic things. Like somebody else help me. You know what I mean? Because it's just, you don't want to make a mistake.
Yeah.
You know.
Do you do stuff on Gus, like personally? Like, would you do like surgery?
I neutered him.
Oh, did you? Okay.
I did.
I can't.
I'm a control freak, and I was like, I must do it. And it was beautiful, beautiful.
You're fine.
No, I mean, I think there comes a point. I was thinking about it today as I was removing a sock from a dog's intestine, and I was thinking this will be Gus one day because he likes to eat socks. And I was like, I don't know if I can do it. Like, I don't know if I can be the one to do this. Like, this is different than a neuter to me.
Yeah.
So
that's the thing. Like, I can maybe,
I don't know. I think I'll have to be in this situation, and I will know at that point in time. You know what I mean?
It's 2 to 3 years. We'll find that sock, and you let us know.
6 months. We'll have this conversation this summer. No, I try everything. I joke, but I really do not want him to get a foreign body. I can't tell my kids every time, I'm like, put your socks away. Socks. It's because it sucks. And that's what I pulled out of a dog today. I was like,
it happens all the time. Happens all the time.
And the thing is too, is the story was kind of, she's like, oh yeah, he'll vomit a sock like once every 6 months. I'm like, Gus. This is gonna be me. I know.
I'd say it's probably
I've
the most
already
common
been saving the money though. Like I already have it. I already have a fund. I have a get a sock out of Gus fund because I know it's going to happen.
That's smart though. It's, I mean, it's planning for that emergency that will happen. If it never happens, great. You can go to Disney World 1 year instead. Yeah. But until he's out of that age range, if he ever gets out of that age range,
he's a lab. He's a walking stomach.
I know, but they also pass incredible things.
They are. And he's thrown them up all so far. So anyway, we're getting totally derailed from dental disease. But the point of the matter is
dental health is very important.
Dental health is very important. Don't let your dogs chew on femur bones. Yep. And even people love to give deer antlers to their dogs. And so I always tell people, I'm like, well, you can do it, but they definitely can break their teeth on them.
Yeah. Honestly, I think it's like the softer stuff to chew on is the best. And
yeah. And look for dental chews. I have an opinion on rawhides.
I don't have a good opinion on rawhides personally. Like yeah, there's only one brand that I've actually somewhat been okay with. It's like easily digestible. But even then, like my dog goes to town on it, always has diarrhea afterwards. And so many dogs come for that very reason.
So fattening.
And they're fattening. That's also very true. I didn't even think about that side. I'm more about the diarrhea that I see owners for at night. They're like,
well, considering I'm telling every dog to lose weight pretty much all day long, I'm not a fan. And I pulled one out of Phoebe's throat that she was like it just wouldn't break apart. So I was like, oh my gosh, I had to pull it out of her throat. So they make me nervous. I think any chew you give your dog ever, you should watch them with it. I don't care what it is. Because there's a potential for them to choke on anything and you should be there. So I think that there's things that are safe that you can leave with a dog for them to chew on, like a topple or a Kong or something like that, where you fill it and you put stuff in. But any kind of a bone, rawhide, nylabone, antler, bully stick, I don't care what it is.
Watch your dog.
Have parental guidance. You should always be there. I actually like bully sticks. I think they're fine. I have no problem with bully sticks. I have a bully stick holder, so like you screw it in so that he can't swallow that last little chunk too fast.
That's smart.
So that's pretty cool. Rawhides, I know that CET, like Verbac, CET makes the dental rawhides. I do think they're actually good. They actually have chlorhexidine in them, and they sit.
Those are the ones I was talking about because the ones that are like good for easily digestible.
Exactly.
Yeah.
However, that was the one that like I had to pull out of throat. So I am not super. I know people love them and all that, but I'm just not super comfortable with them. But they make a veggie dent chew that breaks apart, kind of like a greenie. I think they're better than greenies. Should I not say that? But anyway, I
not until they sponsor us, it's fine. So not until they sponsor us. Yeah, greenies, we're talking to you.
I mean, I love greenies. So and greenies are fine. They're VOHC. I think. I don't know. I have to look.
Yeah. I think
I
give them a look every once in a while. So
yeah, no, I know there's nothing wrong with them. I just think the veggie dents. My dogs loved them. If people tell me that they are feeding greenies to their dogs, I'm like, great, no problem.
Oh, yeah. And that company it does help.
Pill pockets, which I love. So I have nothing against greenies. Greenies are great. But I really like the veggie dents too. Those are really good. So I mean, there's lots of different products out there, and they're but I think rule of thumb: watch what you give them. Nothing too hard. Early prevention is best. Regular dental cleanings with your veterinarian when they say that it's time. Believe them. They're only trying to help, and they're not going to pull teeth that are healthy. I promise. No veterinarian wants to do that. Yeah. And then, VOHC.
Love it. It's been a wonderful podcast.
Well, anyway, this has been the Pause It podcast talking about Dental Health Month, February. Woohoo!
Yeah.
And thanks for listening. We hope you enjoyed it, and stay tuned. We got some cool stuff coming up this month, like we said. So give a listen.
Get excited, folks.
Yeah.
See you guys all soon.
Bye.